Problema ko ng pasahe, punta sa Ilonggo.
Maririnig ka. Magandang hapon po. Magandang hapon sa lahat ng tagapakinig at tagapanood. Pagpapatuloy po natin ang ating topic about the Yin Yang. Contradiction. So, yung contradiction po, ito yung mga example. Yang exists, example 1. Pag healthy po tayo, ganyan balance yung ating energy. Yung yin at yang magkapantay. Tapos, pag meron pong may pathogenic factors, yung second po natin, drawing, may pathogenic factor na darating, yan, pwede pong maapektuhan yung balanse ng ating yin and yang. So, yung increase, if exposed to yung factors, halimbawa nga po, yun, nagpainit ka, tapos, kumakain ka ng ng mga spicy food, mayroon pa infection at saka allergy. So, pwede pong yan ang maging reaction ng katawan natin. Papatong po dun sa yang, yung mga heat. Yan. Then, ang magiging reaction po uli nung yin, dahil healthy ka naman, sasabayan po niya yun, tataas din po siya. Yan. Next, the healthy yin increase in order to control the excess yang. So, andyan po yung nararamdaman natin na chichil and fever. Pag acute pa lang po kasi lumalaban pa lang yung natin antipathogen. Kaya nakakaramdam tayo ng chills and fever. Okay po. So, if the yang increase by any reason, a healthy yin will not accept this without opposition. So, yun nga yung sinasabi po natin, kung healthy at balance yung energy natin, basta't may pumasok, lalaban yung ating antipathogen o yung energy natin sa katawan, lalaban siya. It would increase as well, thus causing temporary state of excess in both energies. So, lumalampas siya dun sa balance ng energy, causing fluid and heat. This yin is released by the body in order to cool and control the heat. Yun nga po, ang example nito, sweating from heat, vomiting and diarrhea in gastroenteritis. So, ang reaction po ng katawan natin, 'di ba, pag naiinitan tayo, magre-release siya ng ng pawis para i-cool down. Tapos yun naman po sa habang nagdudumi ka, yung nag-LBM, nagsusuka din. Yun po yung reaction ng katawan. Tapos pag may excessive mucus in bronchitis, so pag sa baga naman po, magpuproduce ng mas maraming mucus. Pag sa paa naman, or magkakaroon ng edema or effusion in joint inflammation. So, yun po yung mga way ng katawan natin, pinapataas niya yung yin or yang para binabalance muna niya kasi lumalaban nga po siya. So, treatment, it is sufficient to sedate yang only. So, kung nakita mo pong tumataas yung ganon, pwede mo pong pababain yung yang o yung heat na nakita mo dun sa katawan. It could also support the yin. Even in this case, where the yin is excess, it's possible to support it so that the yin would not be consumed by the excess yang. So, pwede po rin nating itonify, pag ganun palang situation, itonify din po ninyo yung yin para nga hindi siya i-consume ng yang. Para bumaba man siya, andun pa rin siya sa level. Kasi kung hindi natin ito-tonify, pwedeng below the level siya, dun sa normal balance. Pag naipalakas natin ang yin, so madaling siya, yun po yun yung panahon na madaling umalis yung nararamdaman, madaling gumaling. Po. So, it is possible to increase and decrease energies with acupuncture. So, sa pamamagitan po ng pag-acupuncture natin, andun alam natin kung paano i-decrease o babawasan at palalakasin. May mga points po sa meridian na madali nating pwedeng i-tonify or increasing energy and for sedation or decreasing energy. Halimbawa po niyan, ang CV8, kung ang problema mo ay masyadong mababa yung iyong energy, warms the yang. Kung masyado pong halimbawa may problema po sa spleen, so pwede ka pong mag-sedate para mapababa mo yung coldness. Ay naku, wait po Dok ha, tumutunog yung aking, Dok, saglit po, nga po saglit at yung aking power. Hello po. Okay. So, yun po. So, ito tonify natin upang tumaas ang mga mabababa na energy. Kung mababa ang yin, itonify mo. Kung mababa ang yang, itonify mo rin po. Kung excess, i-decrease mo o i-sedate. So it is possible to influence only the yang or only the yin. In this case, treatment will be to reduce only the yang as this is cause of disease. Ay, sorry po kasi yung solar power ko So, it is possible to influence only the yang or only the yin. In this case, treatment will be to reduce only the yang as it is cause of the disease. Yun. Halimbawa po, ang tumataas ay yung yang, i-reduce natin. Increase of yin in this example is only a reaction to the yang increase. So, pababain po natin yung yang kasi yung pagtaas ng yin, nagre-response lang siya dun sa pagtaas ng yang. If the yang is reduced, the yin or the dampness should go down automatically. So, pag napababa na po natin yung yang, yung yin, pupunta rin po siya uli sa normal. Kung nasa healthy state pa po yung katawan. Okay lang po, baka may gusto pong mag-add ng mga example o karanasan kung paano po yan. Halimbawa po niyan, ayan, yung drawing natin. Yin excess, example 2. Pag normal at nasa balance at healthy ang ating katawan, ganyan po balance siya. So, maaaring tumaas yung yin kung na-expose tayo sa lamig or kumakain tayo ng mga lot of fatty foods, tapos raw foods, close stuffy environment, o lagi ka sa aircon. Yun. Pwede pong makakaramdam tayo ng sobrang lamig kasi tumaas yung yin mo Maaring ang pulse mo dyan full. Full po dyan. Tapos siyempre may coldness. Yung tang po, pag tinignan natin ang tang dyan, thick white at the center. Kung spleen po yung may problema. So ang gagawin nung energy natin, yung yin and yang natin, yun, hahabol yung yang. So, next, the yang increase to fight the yin excess. So, yun po yung sinasabi doon kaninang example. So, marunong po talaga yung katawan natin. If the yin increase, for any reason, the yang will react to this. Ganun po yung gagawin, magre-react siya, tataas. Yun yung ng opposition, lumalaban siya. By rising up to oppose and control the yin. So, yun, iko-control niya, sasabayan niyang tataas din. This causing again damp heat situation. This heat is caused because of the dampness. Example for this would be in plain acne, varicose, eczema, itching and bleeding, psoriasis, recurrent symptom of gastritis in an obese person. These are situations where the yin is excess, or this is stagnation of thick fluid blood, such as in oily skin, edema in legs because of varicose vein or circulation problem, obesity and thick raised skin in psoriasis. These are conditions where there is more substance and retention of fluid with poor circulation. Kasi mga dampo yun Ibig sabihin talaga nag-i-stagnate. And where there is stagnant dampness can generate heat. Dampness causes stagnation and pathogenic heat. So pag nag-stagnate na po siya, tataas na yung yang. So kaya makakaramdam na tayo rin pasyente ng mga sign and symptom of heat. Okay po? So ang gagawin po natin pag ganon, kung mataas ang yin, pababain po natin. So sedate yin only. Support the functional chi, no moksa, but use bakshu point. So yung functional chi kasi 'di ba siya yun yung namamahala para sa function to warm. Kasi sobrang mataas si yin So bakshu point ang gagamitin. Tapos pwede rin po tayong gumamit ng low connecting point of yang organ. Kung may maghahanap tayo ng mga low connecting loop connecting point. Ano ba yung mga loop connecting point natin? O, ang example po dyan, halimbawa yung spleen 4, loop connecting point po yan ng stomach and spleen. So, pwede po natin gagamitin yung mga loop connecting point. Tapos, pwede rin po tayong mag-local cupping therapy. O, na ano po natin kay Dr. Webb kagabi, yung effect ng cupping therapy, di ba? Na talagang yung energy natin ay pinapalakas niya. Tinatanggal niya yung mga heat and cold sa katawan. Kaya pwede po natin gamitin yon. Where the heat is severe, some blood may be let. O, papaduguin po. So yung mga checkpoint po natin, kaya minsan nagpapadugo tayo, gumagamit tayo ng mga checkpoint, papaduguin. Doon din po sa natin, di ba, doon sa pinag-aralan kagabi, doon sa cupping, may mga pamamaraan para matanggal yung heat. Yun yung wet cupping. Okay po. Baka po tayo ay may tanong, may dagdag.
Any comments po from the audience? Okay, so there are actually 4 relationships that Ma'am Mildred will be discussing, pero mas maganda kasi if we do it step by step, diba? So the first one is about opposition, o yung tinatawag na contradiction, diba? So it's just but natural kung may excess po, like today we cited 2 examples. The first one is excess yang. So there is always an attempt to oppose it, di ba? So pag excess yung yang, talagang aakyat si yin. That is why if you feel hot, there will always be sweating. And the second example is adequately explained by citing the situation whether if there is excess yin, there is always an attempt on the part of the yang to rise, di ba? So kaya yung mga medyo tabain, yung sobra yung yin, nagkakaroon ng gastritis because there is always an attempt on the yang aspect to go up in an attempt to oppose the yin. And kung meron kang dampness, magkakaroon talaga ng heat. No? So I hope everybody learned something. If there are questions that you need to clarify. So pwede ba natin i-summarize yung treatment? So it doesn't necessarily mean na pag tumaas, example yung first, no? Yung sumobra yung yang, dahil sa exposure to anything that causes the yang to go up, you don't necessarily have to tonify the yin. Diba? Kasi pag na-reduce or na-sedate mo yung yang, automatic yun. Hindi na mag-o-oppose si yin. Any questions?
Mag-i-stop yung ating antipathogen para lumaban, Doc?
Mm-hmm.
Nilalabanan niya eh.
Yeah, then kagabi nga, no, timing lang, we were able to learn na napakaganda pala ng cupping as an add-on to
yes po.
To our
napakasimpleng gamitin pero ganun pala yung effect sa katawan natin.
Only the best for the patient, di ba?
Opo.
Okay, maraming salamat Ma'am Mildred. So from Yin and Yang, we will continue with ang diagnosis straight from Zamboanga na malapit nang magstay sa Rizal. Let's welcome Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa Tang Diagnosis. Ang topic po natin ngayon ay bago, which is black coating. A black coating often indicates a serious illness. As a rule, it is the result of a long-standing pathology. It indicates extreme heat and cold patterns of disease. Okay? If the black coating is also slippery in appearance, it reflects a deficiency of spleen and kidney yang with excessive internal cold. If this type of coating or a black coating is only visible at the center of the tongue, while the sides show the remains of a white coating, it indicates spleen yang deficiency with accumulation of cold dampness. Now, if the black coating is dry and appears cracked, it can be assumed that there is a serious development in a persistent disorder. This type of coating indicates that the yin is declining, which may lead to its separation from the yang. So alam na po natin kung mag-separate na ang yin and yang, what comes next. Okay? The patient may be in danger since the black coating reflects the development of extreme heat and can consume the body fluids. The drier and blacker the coating, the more severe the exhaustion of yin and fluids. Okay? A yellow coating at the sides and a black greasy coating in the center of the tongue indicate extreme heat in the stomach. A persistently yellow coating reflects long-standing retention of damp heat. Extreme heat in the stomach burns the fluids and causes the black bird-looking coating. So now let's go to our first patient, male, 33 years old. Tongue description: reddish with red sides, contracted tongue body and teeth. Black coating in the center and posterior third of the tongue, yellow at the sides. Symptoms: pain in the throat, dry mouth, feeling of heat in the nose, and occasional nosebleeds, blocked nasal passages, and headache. Western diagnosis is carcinoma of the nasopharynx. Background to disease: smoked for many years, and possible environmental factors, especially pollution. Chinese diagnosis: we have hits in the liver, lungs, and heart, injury to the yin and the upper burner. Long-standing hits in the yang brightness or yang ming channel with injury to the fluids. Okay? Hits in the liver, lungs, and heart, injury to the yin and the upper burner. This manifests a reddish tongue body color with red sides, contracted tongue body shape, and teeth. Patient in this case presented symptoms of pain in the throat, feeling of heat in the nose, occasional nosebleeds, and blocked nasal passages due to a background of smoking for many years, and possible environmental factors, especially pollution. Okay? Then, long-standing hits in the yang brightness yang ming channel with injury to the fluids. This reflects a black coating in the center and posterior third of the tongue with yellow coating at the sides. And in this case, the patient showed symptom of dry mouth. So clear po na ang diagnosis is long-standing hits in the brightness yang ming channel with injury to the fluids. Okay, now let's go to our second patient. Female, 83 years old. Tongue description: red, swollen, slightly pale sides, deviating, black, thick, greasy coating with dirty yellow coating at the sides. Symptoms: slurred speech, constipation with hard, dry stools, loss of memory, inability to move left arm and leg. Western diagnosis is apoplexy with left-sided hemiplegia. Background to disease: high blood pressure for 20 years. Chinese diagnoses are retention of phlegm heat, slight liver blood deficiency, movement of internally generated yin, and retention of phlegm heat in yang brightness, yang ming channel. Retention of phlegm heat. As we can see in the tongue picture, its body color is red with swollen body shape, and the patient showed symptom of loss of memory. So it is clearly an indication of retention of phlegm heat. Okay? Now, slight liver blood deficiency manifests slightly pale tongue body color, particularly in the sides. Next, movement of internally generated wind. The patient presented symptoms of slurred speech and inability to move left arm and leg. And as we look at her tongue picture, it is deviating. And the patient has a background of high blood pressure for 20 years. So this confirms this diagnosis, which is the movement of internally generated wind. Okay? And the last is retention of phlegm hits in yang brightness, yang Ming channel. As we look at the tongue picture, it has a black, thick, greasy coating with dirty yellow coating at the sides. And the patient suffered from constipation with hard, dry stools. So this is a clear indication of retention of phlegm hits in the yang brightness, yang Ming channel. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Does anybody want to make a comment here? Do you like the case? So dito natin makikita one example of a tongue that looks so huge. Napakalaki ng tongue, so that's very phlegm. And maitim yung coating. So ibig sabihin, super tagal na po siya. And so what happened next would be yung iba na niyang mga problem, no? So dito natin makikita na if you cannot really address the pattern at the very early stage, this is what will happen, no? See? Can you imagine if maging ganyan yung dila natin? Napaka-obvious talaga na meron po siya hemiplegia, no? So, anyone would like to make a comment? Share? Okay. Maraming salamat, Ma'am Teresita. And let's proceed to diagnosis by interrogation. Ma'am Mildred, would you like to?
Yes, Doc.
Okay. Kasi alam ko forte na forte mo to and I'm sure you're loving it. Diba? Nakakaano. Sana lahat. Sana all. No? Okay. Thank you po.
Okay, sweating. Tingnan po natin ang clinical significance and exterior patterns. Excessive sweating is always considered a symptom requiring the doctor's attention in Chinese medicine. Talaga po, pag gano'n na sobrang, nagkaroon ako ng pasyenteng ganyan, Doc mamaya. In order to define excessive sweating, we should bear in mind that under certain circumstances, sweating is a normal psychological process. For example, if it is normal to sweat during exercise, syempre pag gumagalaw ka po, normal na dapat may pawis na lumabas. Kasi ginagamit mo yung yin mo kaya tumataas yung yang, kaya papawis ka. After eating spicy food, ayan, naglalagay ka ng heat in every hot weather and when under acute emotional strain. So, why we ask? So, daytime spontaneous sweating is not a crucial area of questioning for various reasons. First of all, it is a symptom that only Chinese patients are particularly aware of, in which they therefore often report spontaneously. Western patients report these symptoms quite rarely. In terms of clinical significance, as part of a pattern, daytime spontaneous sweating is seldom a crucial manifestation that clinches a diagnosis. So pag umagang nagpapawis ka, kung hindi naman grabe, pag spontaneous na, ibig sabihin may organ talagang may problem. So ano yung responsible na organ sa pagkuklosing ng ating pores? Siyempre yung ating lungs. Kaya kung ganun na po na nag-spontaneous sweating kahit walang ginagawa, talagang dapat pong ma-address na natin yon. An exemption to this occurs when we see a patient during an acute invasion of wind, in which case we should always ask whether there is sweating. The presence of sweating indicates that the pathogenic factor is either wind heat or wind cold. But with prevalence of wind, yung wind attack pattern of the greater Yang pattern within the 6 stages. And that patient's upright chi is relatively weak. Conversely, absence of sweating during an invasion of external wind generally indicate that cold predominance over wind and that the patient upright chi is strong. So clear naman po dyan ano. So pag may may wind cold, hindi ka magsusweat kasi cold nga yun eh. Pero pag wind heat yung papasok, nagsusweat ka kasi nag-a-add yung tumataas yung yang. Yun. So pag night sweating naman is quite different insofar as Western patients are more aware of these symptoms. In particular, yung mga menopausal na babae, yan ang pangunahin minsan na problema. That is definitely reported by the patient. Kasi nga, nag-i-issue po yung nag-menopause so mababa yung yin, kaya nagkakaroon ng night sweating. Night sweating is clinically significant to clinch the diagnosis of yin deficiency. Although, it should be remembered that other pattern may cause night sweating. Example, damp heat in the stomach, heat, at saka yung mga iba pang heat. Yun. So, pag nag-night sweating po, bukod dun sa, tingnan natin yung pattern, ano bang mga organ ang affected. Yung example po dito, kung may damp heat sa stomach, pwede mo po siyang ipasa sa lungs, yung heat na yon. So, manghihina yung lungs, hindi niya ma-close yung pores, kaya, yun, tuloy-tuloy po yung pagpapawis, kahit gabi. When we ask, I ask about daytime sweating, mostly to confirm a diagnosis of Yang Deficiency. Yan, tinatanong po natin sa umaga pa, grabe ka ba magpawis kahit di ka gumagalaw? O konting galaw lang na mamawis ka. So ang ibig sabihin po nun ay may Yang Deficiency. And about night sweating to confirm a diagnosis of Yin Deficiency. So pag Yin deficient naman yun, sa gabi po na mamawis. If nighttime sweating appears without any manifestation of yin deficiency, then we need to think again and check whether the symptom is being caused by damp heat or other less common patterns. So yun, napakahalaga po kahit hindi mababa yung yin, pero matindi pa rin siyang mamawis, tingnan natin nga kasi kung may mga damp heat, yun, nag-a-add po ng heat, hindi nagbabalance yung yin and yang, kaya lalaban yung energy, tataas yung, di ba yung kaninang pinag-aralan natin, mag-create siya ng panlaban yung pathogenic factor, lalabanan ng ating anti-pathogenic factors. How we ask, when asking about daytime sweating, I generally ask, do you tend to sweat abnormally even in the absence of exercise? Yung kahit di ka gumagalaw, namamawis ka. In the case of nighttime sweating, the question is easier and simply asked. So, tanungin po natin, do you tend to sweat at night sometimes, namamawis ka ba sa gabi? We should, however, exclude night sweating. That is simply caused by too heavy a blanket at oo nga naman. Baka naman kaya siya namamawis kasi ang kapal-kapal ng suot niya or ang kapal ng jacket niya. So, kino-consider po natin or yung kanya namang room, kulob na kulob. Kaya, i-clarify po natin yon para tama yung ating diagnosis. So, clinical significance of sweating in exterior pattern. Exterior patterns, spontaneous sweatings indicates invasion of wind cold with the prevalence of wind due to the disharmony of nutritive and defensive chi. Yung defensive chi natin ay nire-release ng lungs yung wei chi. Or invasion of wind heat. In invasion of wind cold with the prevalence of wind. The deficient nutritive qi fails to hold fluids in the space between the skin and muscle. So yun nga, yung sa mga malnourished din po, pag kulang ng nutritive qi, ito yung food qi, syempre manghihina po yung function na to hold in the space between the skin and muscle, kaya lalabas yung fluids. The pores are open, hindi nyo make-close, and the patient slightly. Sa mga mahina yung weight qi, mahina yung nutritive qi. It is important to note that this is not a prop use. Yung spontaneous sweating in the patient may not be aware of it unless we ask. Kasi akala nila normal lang. So, yun, makikita natin yung pattern ng qi nila, ng weight qi nila kung okay. And exterior patterns, slight sweating may occurs during invasion of wind heat. So, pagpapasok yung wind heat or wind dampness or summer heat, so nagsusweat. In the course of acute febrile disease, when the pathogenic factors penetrate into the interior, there is often profuse sweating, such as the bright yang stage of 6 stages or the qi level of the 4 levels. Kasi nga pagpapasok pa lang, di ba yun nga, lalaban yung ating antipathogenic qi. Kaya nagkakaroon ng, parang yung may nag-fever ka, magkakaroon ka ng sweating kasi lalabanan niya yung heat. So, yun po yung nangyayari. Baka po may addition.
Okay. Thank you very much, Ma'am Mildred. So that was very helpful.
Thank you po.
Thank you. Okay, so wala pa si Sir Dino, but is he there? May pumasok. Wala. Okay. So we will take over pulse diagnosis. Okay. Yung aaralin nating pulse is long pulse. Mahaba na pulso. Okay. Since mahaba, longer siya than normal, it extends lengthwise beyond the pulse boundary. So lagpas-lagpas. So to judge whether a pulse is long, normal, or short, you have to roll the finger back and forth, distally and proximally on each position. Clinical significance. So if meron tayong long pulse na palpate, it indicates heat. It can also indicate liver disharmony, no, of the full type with rebellious qi, katulad ng liver yang rising or rebellious qi in the penetrating vessel. Aside from heat, the long pulse would also indicate phlegm. If the liver pulse is relatively soft and feels like the tip of a long bamboo pole, it indicates harmonious state of the liver. So normally pala, ang liver pulse should be soft. If the liver pulse is full and slippery, and it feels like moving along a long bamboo pole, it indicates liver disease. So kailangan hindi po siya full and slippery. If the pulse is long, relatively soft, slowed down, neither floating nor deep, neither rapid nor slow, neither full nor empty, it is a sign of health. So what are the common conditions na nagpipresent with a long pulse? Liver disease, hypochondrial pain, mental illness, rebellious qi in the penetrating vessel, and hemoptysis. So if the pulse is long on one side and short on the other, it is a serious problem. So check na natin yung pulse natin. Usually the side displaying the long quality is also wiry, fine, and rapid. For example, if the left side pulse is long, wiry, fine, rapid. Tapos yung right side pulse is short. So magkakaiba. The person is extremely nervous. Meron po siyang liver and heart disharmony. If the right side pulse naman is long, weak sa lung position, fine, tight on the middle and rear positions, then short on the left side, so it indicates stomach disharmony and general Qi deficiency. So let us summarize the implications of long pulse. Heat, liver disharmony, phlegm, health, relatively soft, slow down. So kahit long siya pero soft, tapos slow down, hindi siya floating nor deep, neither rapid nor slow, saka neither full nor empty. Combinations. If you have a long pulse and then it's rapid, obvious to obvious, it is internal heat. If the long pulse tapos slow, Qi stagnation. Long floating, invasion of external wind heat. So this is already a key word, no? Floating. Alam na natin may external invasion. Long and deep, internal heat. Long, wiry, liver disharmony, full tight. Long, slippery, so very easy, phlegm, heat. Long, overflowing, excess of yang and heat. Long, firm, internal accumulation. Long, overflowing, hollow. O yan, yung mga ano dyan, baka nakaka-relate. So the next time you see a patient who is hypertensive or diabetic, you might expect this combination. Long pulse, tapos overflowing, hollow. Hollow, kasi masyadong deficiency. So how do we differentiate long pulse from other pulses? So anong pagkakaiba ng long pulse sa overflowing? Long pulse will extend beyond the pulse positions lengthwise. So you move back and forth from proximal to distal. It is not superficial, ang long pulse. The overflowing pulse, nag-extend po lagpas-lagpas beyond the pulse positions in all directions, and it is superficial. So hindi po binigay ni Lee J. Chen yung clinical significance po ng long pulse. Okay? So I hope that helped. Any questions po? Okay, I know you're all
At po,
excited.
malinaw, Doc.
Yeah, malinaw.
Yes,
I'm
the
sure
message is very clear.
check nyo na yung mga pulse, wala na yung mga diabetic dyan, pati hypertensive. Okay. Long, ano ba yung diabetic? Hollow and, yeah. Okay, now let's listen now to Ma'am Nitz Yu for a very interesting topic on differential diagnosis. Good afternoon, Ma'am Nitz.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc?
Very clear po.
Thank you. Okay. The topic for today in our 167 TCM Foundations is kidney deficiency combined with liver, heart, and lung deficiency. Okay. So as we know, liver stores blood, while the kidneys store essence. Okay. Liver blood depends on essence for nourishment, while essence depends on blood for replenishment. Both have a common source, grain chi, buchi, derived from the spleen. In terms of the five elements, the kidneys nourish the liver. A long-term liver blood deficiency, blood is yin in nature, can cause kidney yin deficiency, okay? Usually, this appears as a liver and kidney yin deficiency. Dry eyes are one of the most distinctive symptoms of liver yin deficiency due to the yin of the liver being unable to moisten the eyes. Dream disturbed sleep, insomnia, limbs numbness, blurred vision, and scanty menstruation or amenorrhea in the worst cases are all symptoms of liver blood deficiency, which is part of liver yin deficiency. Okay? Headache is also due to liver blood deficiency. It tends to be either occipital or vertical on the vertex of the head. Okay? The infertility, which is mostly seen in women, is because of deficient liver blood, failing to nourish the uterus, and to deficient kidney essence unable to promote conception. Okay? Harmony between the heart and kidney refers to physiological relationships between the two sang organs in Chinese medicine, while disharmony between the heart and kidney, also called disharmony between fire and water, refers to pathological state. So, the pattern of disharmony between the heart and kidney is widely observed in patients with insomnia, anxiety disorder, and menopausal syndrome, and etc. Okay? Ang etiology ng kidney deficiency ay with combination. As for kidney deficiency, the same. Underlying and accompanying pathology, deficiency of one organ may lead to or develop from yin deficiency of another. Okay? Signs and symptoms. In addition to kidney yin deficiency signs, yung may liver yin deficiency ay mayroong headache, blurred vision, poor eyesight, irregular menses, sterility, yung hypertension, neurosis, menstrual disorders. Okay? Kidney deficiency with heart yin deficiency, may insomnia, heart palpitations, forgetfulness, profuse dreaming, tachycardia,
movement,
hyperthyroidism, neurosis. Sandali
paranoia,
lang po ah.
insomnia, depression,
Sandali lang po ah. Okay.
Pakimute
Ah,
ng...
nakamute na po. With lung yin deficiency, kidney yin deficiency with lung yin deficiency, yun yung may cough, may expectoration of blood, may steaming bone tidal fever na nangyayari sa pulmonary TB. Okay? Ang pulse, pag tiningnan natin, pinalpate natin, floating, empty or rapid if more severe. So, may empty hit. Tingnan ang sa empty hit, pareho lang sila. Ang tongue may be normal in color without coating or red if more severe. Sa empty hit pa rin. Meron ganon. Treatment principle, enrich kidney in clear deficiency heat. So, acupuncture treatment, as for yin deficiency plus pagka may liver and kidney deficiency, use bladder 18, liver 3. Additional, pagka may heart and kidney deficiency, bladder 15, bladder 17, ren 14, PC6, and heart 7. So, pagka may lung and kidney deficiency, use bladder 13, bladder 43, and lung 5. Technique, needle with supplementation. So, use additional points according to symptomatology as per kidney deficiency. So, you have to be observant. Thank you very much.
Thank you very
I
much,
hope
Ma'am
you
Lee.
learn.
I hope everybody liked that.
Thank you po.
Thank you, Paul. Okay, from differential diagnosis, we will proceed to acupuncture patterns and practice. Let's call on Ma'am Teresita Sumile once again. Good afternoon, Ma'am Teresita ulit.
Good afternoon po, Dr. Hector, and good afternoon din ulit sa mga kaklase. Pattern practice topic po ay dementia. Part 2 na po tayo. Turbid phlegm is obstructing orifices. Symptoms, red face and eyes, sudden violent anger, staring angrily without speaking, erratic movement in language, paranoia, insomnia, depression, epigastric and abdominal fullness and distension, self-inflicted harm, constipation, turbid urine, a thick yellow greasy tongue coating, and a deep and slippery or rapid and forceful thoughts. Treatment principle, strengthen spleen and expel phlegm, soothe the liver and regulate qi, and open the orifices and move the squeeze. Main acupuncture points, liver 3, Yuan source point of the liver to spread liver qi, clear heat, promote circulation, soothe emotional outbursts, and calm the mind. Bladder 18, Bakshu point of the liver to regulate and smoothen qi flow, resolve depression, and harmonize the liver. Stomach 40, expel phlegm and dampness. Spleen 9, to invigorate spleen, harmonize middle jaw, and expel dampness. LI 11, to clear intestinal heats and calm the mind. Do for 23 and do 24 to clear the head and open the orifices. X, H, and 1 to benefit the brain and open the orifices, and then we have supporting points. GB14 and GB20 to treat extreme cases of panic psychosis. Stomach 44 to clear stomach fire with damp heat obstructing the orifices. Then AXUE to revive consciousness and open the senses. Next is marrow depletion. Symptoms, dull expression, palpitations, forgetfulness, lethargy, vertigo, tinnitus, poor appetite, pale lips, nail and tongue, pale complexion, thin, loose stools, a pale and enlarged tongue with white and lacking coating, and a thin and white pulse. Treatment principle, tonify qi and nourish blood, invigorate brain and awaken the mind. Main acupuncture points are do 20 to open the orifices and awaken the mind, calm the spirit and nourish, sea of marrow. AX, H, and 1 to benefit the brain and open the orifices. Stomach 36 to promote qi blood circulation. GB 39, influential point of marrow to nourish marrow, benefit bones and sinews, treat vertigo and tinnitus. Do 16 to nourish the sea of marrow and calm the mind. Bladder 17, influential point of the blood to activate blood circulation, dispel stasis, and unbind the chest. We have supporting points here, AX, H, and 24 to calm the spirit, treat insomnia, vertigo, and mental disorders. Heart 7, Yuan source point of the heart to regulate and tonify heart qi, calm the spirit, and treat amnesia. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Do we have any questions?
Yun po, Doc.
Clear po.
Okay, very good. Masyado tayong tahimik. Okay, so let's now listen again to Ma'am Mildred for signs and symptoms. Kasi
Yes po.
mukhang absent sila. Baka medyo walang signal.
Oo nga po, makulimlim dito po sa amin. So, sign and symptoms 50, sore throat. Yan, ngayon, taglamig. Taglamig, tag-init. Sore throat. Full invasion of pinheat. Acute sore throat. Itchy throat, shivers, fever, slight sweating, headache, tongue red on side or front, or thin white coating, rapid falls. So, yun po yung makikita natin pag may invasion of wind heat. So, exterior pa lang po So, ang pwede po nating igamot, acupuncture ay ang large intestine 4 at saka ang TV o triple burner 5, bladder 12, lung 7, lung 11, at large intestine 11. So, yung po sa sore throat. So, empty or full.
Ayaw magwadamihan.
Lung and kidney yin deficiency with empty heat. So, pag lung and kidney yin deficiency, ito pa ang pwedeng mga sign and symptom.
Ianli mo na.
Chronic sore throat, dry and red throat, dry cough, dizziness, tinnitus, night sweating, palm heat, dry throat at night, red tongue without coating, floating, empty, and rapid pulse. Kasi nga heat po yun kaya ang makikita natin lahat, red, hotness. Yun. So, ang pwede po nating acupuncture points at ay lung 7, kidney 6, kidney 3, ren 4, kidney 10, spleen 6, large intestine 11, lung 9, lung 10, ren 12. So, yan po yung mga acupuncture points na pwede natin gamitin kung involved po ang lung and kidney. So, yun yung kidney yin deficiency with empty heat. Other patterns. Damp heat in the stomach. Yung mga umiinit po yung mga tiyan. Yeah. So, pwede pong dahil sa chronic ng sore throat, swollen throat with purulent spot, a feeling of fullness and pain of the epigastrium, a feeling of heaviness, facial pain, stuffed nose, or thick sticky nasal discharge, thirst without desire to drink, kahit uhaw ka pero ayaw mong uminom kasi nga mayroong maraming damp, parang puno. So, nausea, a feeling of heat. Pati po yung yung balat niya dull yellow complexion kasi heat nga po. Tapos, sticky taste. Sticky dahil may damp. Red tongue with sticky yellow coating. Tapos, slippery rapid pulse. Slippery dahil siya ay may damp. So, stomach fire. Sore throat with severe pain. So, pag talagang matindi po yung yung mataas yung yang, makakaramdam ng severe pain. Swollen and red throat. Yun. Intense tears with desire to drink cold liquid. Gusto mo umiinom ng malamig na tubig. Burning epigastric pain. Mental restlessness, dry mouth, nanunuyo po yung bibig. Tapos yung parang nag-ulcer, yung parang nagsusugat-sugat na yung bibig. Nagkakaroon din po ng pagdurugo yung gums. At yung dumi ay matigas. Sour regurgitation, yung parang laging maasim yung pakiramdam. Full breath, nausea, vomiting, soon after eating, a feeling of heat, tongue red with thick, dry, dark yellow coating. Thick po kasi talagang full. Fire yun stomach fire. Pag tiningnan po natin ang pulso, deep, full, rapid pulse. Deficiency of Qi and Yin. Chronic sore throat. Slight pain after aggravated by exertion. So, shortness of breath. Tiredness. Mahina rin po yung boses. Pag umuubo, dry. Pag tinignan po natin ang dila, pale, tongue, weak pulse kasi deficiency po ng Qi kaya mahina ang kanyang pulso. So yun po yung mga sign and symptom. Basta may deficiency, weak. At saka makikita natin pain. Okay po. Qi stagnation. Pag may stagnation naman po yung Qi. So chronic sore throat. Ang sore throat po ay chronic na. That comes and goes under to the emotional state. Halimbawa, nagagalit ka, biglang nagkakaroon ka ng sore throat, namamagay yung lalamunan. Tapos, makakaramdam ka ng parang lump in the throat, parang namamaga with a feeling of difficult swallowing. Hindi ka na, mahirapan kang maglumod. Yun, irritable din po, magagalitin ka. Tapos sighing moods, depression, sadness, wiry pulse, other symptoms and signs depends on the organ involved, which may be the liver or the lungs. Siyempre, pag emotional kasi, siyempre yung liver po ang nag-ano sa emotion natin. So, dadali niya sa lungs yung stagnation. Apektuhan talaga. So, clinical note. Apart from chest stagnation, the throat area can suffer only from heat, full or empty condition. Remember, chest stagnation in the throat does not always derive from the liver. It also may derive from lungs, the lungs, heart, and stomach. O, kasi yung cycle po, di ba? Sa Yang cycle, sa co-cycle, aapektuhan po niya yung mga organs. So, hindi lang siya galing sa liver. Okay po? May tanong po, may dagdag?
Thank you po. So at
Thank
least
you po.
alam na natin na marami palang patterns ang sore throat, no?
Opo, hindi lang talaga siya sa lungs.
Yes. Thank you very much. Mukhang tahimik, parang may bagyo. Okay, let's now proceed to the last topic, and this is the conclusion of the topic on anxiety. And we have again Ma'am Teresita Sumile to give us the case histories. Good evening, Ma'am Teresita.
Good evening po ulit, Dr. Hector and classmates. Anxiety 13 case histories. Our first history is a 40-year-old woman had been suffering from severe anxiety for many years. She was constantly anxious and a panicky feeling with that she experienced in the chest. She had a frightened and restless look in her eyes. Her severe anxiety caused her great stress. Although she did have some problems with her work and finances, they were not serious enough to warrant that level of anxiety. On interrogation, it transpired that she had always been a worrier, ever since she was a teenager. She also suffered from dizziness, occasional tinnitus, and night sweating. When she was anxious, she also suffered from palpitations and sweating. Her face was red and her tongue was red, with a deep part crack and almost totally without coating. So this indicates Yin deficiency. This pulse was fine and rapid. Diagnosis. Her tongue and pulse indicate a clear condition of Yin deficiency, tongue without coating. With empty heat, the tongue is red. The heart crack, palpitations, and anxiety indicate that the Yin deficiency is affecting the heart. The dizziness, tinnitus, and night sweating indicate that the kidneys are also affected. In her case, therefore, the anxiety is due not only to the heart, but also the kidneys, which manifest an emotion of fear. Her anxiety was largely of constitutional origin. The deep heart crack leads to this conclusion. Such patients are very difficult to treat as the anxiety is ingrained in their mental emotional constitution. The look on her eyes also leads to believe that her anxiety might also be due to a feeling of guilt, but she did not show any willingness to discuss this. This patient was treated with acupuncture and selected points from the following pool of points, which are heart 7, pericardium 7, do 24, REN 15, stomach 36, spleen 6, REN 4, and kidney 3. This patient was treated for over a year with both acupuncture and herbal medicine. She made a remarkable improvement a marked reduction in her levels of anxiety. However, she could never be free of it completely. This is probably due to the fact that it was constitutional. Therefore, the treatment was stopped but advised her to come back for a few treatments every 3 to 4 months, which she did. Okay? Next, history. A 42-year-old woman had been suffering from anxiety ever since the birth of her second child 5 years previously. Her anxiety was mild but constant and disabling. She had a vague feeling of anxiety without being able to pinpoint the cause of or the object of it. She also slept badly. Her health was otherwise good apart from complaining of palpitations, blurred vision, and tingling of the limbs. Her tongue was pale and her pulse is choppy. Diagnosis. This is a very clear example of anxiety deriving from heart blood deficiency as evidenced by the anxiety, insomnia, and palpitations. There was some liver blood deficiency as evidenced by the blurred vision and tingling. Her tongue and pulse confirmed the blood deficiency. In her case, the blood deficiency arose after the birth of her second child. This is a common cause of blood deficiency in women and one that may also give rise to postnatal depression. Okay? Treatment. The author treated this patient primarily with acupuncture and with herbal remedy. The points that he used were selected from the following. When for 1U1, stomach 36, liver 8, spleen 6, heart 7, to nourish the heart blood, do 24, and REN 15 to calm the mind. Another case history. A 50-year-old woman had been suffering from anxiety for a long time. She experienced her anxiety more in the daytime, and her sleep was good. She worried very easily about the smallest things. She was rather overweight and felt cold easily. She suffered from lower backache and dizziness, and her urination was frequent and her urine is pale. The author inquired about her working life, and she had been overworking for many years, leaving home early in the morning and returning in the evening. Her tongue was pale and her pulse was weak and deep, particularly on both rear positions. Diagnosis. In this case, the anxiety derives clearly from a deficiency of the kidneys and especially kidney yang. Fear is the emotion pertaining to the kidneys. Treatment. This patient was treated with a combination of acupuncture and herbal remedy. The acupuncture points used were selected from the following. REN 4 with moxa, bladder 23, kidney 7, kidney 3 to tonify kidney yang. Do 24 and REN 15 to calm the mind. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Do we have any questions before we take a break to prepare ourselves for the next webinar? Okay, so kung wala pong questions, we would like to thank everyone for joining, especially the presenters. Ingat po and see you later at 8 o'clock. Good evening,
you po.
everyone. Thank you po. Bye-bye.
Good evening.
Good evening.
See you
Bye.
later.
Thank you po.
Okay po. Thank you.
Thank you.